Hi everyone, I'm Dr. Roman. I'm a hematologist oncologist, and today I have encouraging case number 3 for you, and it's about an IPMN. And I'm going to dare to say that developing an IPMN was the best thing that could have happened to this patient. And I mean it when I say that, and I'm going to prove it to you. Now, those of you who follow my channel know that I have an IPMN. I have 2 of them, and it's something that I live with. So when I see an IPMN case, I pay a lot of close attention because, again, I have this. So this is a truly fascinating case, and it goes to show you, it's just amazing. It's one of these things that when I see cases like this, it gives me particularly some hope. And this is a case about a patient who was found to have an IPMN, and it turned out to be a blessing. Now, as always, I'm not here to give you any medical advice, okay? And this patient shall remain anonymous, and I actually asked permission from the patient, and they gave me permission to present this, even though I'm just going to give you very basic information. And in a nutshell, this patient was diagnosed with an IPMN and was sent to me. CA19-9 was normal, CEA was normal, endoscopic ultrasound as well as MRI found a 1.7 centimeter cyst in the body of the pancreas. So 1.7 centimeters, so medium size, if you will, with no high risk features. So basically told the patient, we can repeat a scan. I wanted to do it in 6 months. Patient told me, you know what, that's a little too close. I don't like the MRI scanner. I'd rather have an MRI in a year. So I said, okay, fine. So a year later, the patient had the MRI with contrast, and the report came back to me that the cyst was stable, but the radiologist said, there seems to be something going on in a part of the colon that was imaged. So I said, okay, well, I did the MRI for the pancreas cyst. They find a little something in the colon. So I sent the patient to GI. I actually called the gastroenterologist and I said, patient hasn't had a colonoscopy in several years, so perform a colonoscopy. So the patient comes back to see me about 2 months later, and I look at all their stuff and I'm like, hey, you had surgery. And when I look at all the report, turns out that something in the colon was an early stage colon cancer. So think about that. This patient developed or was found to have an IPMN. That prompted we performed an MRI a year later. That found a lesion in the colon. Because of that, underwent the colonoscopy. Lo and behold, colon cancer, had surgery, and they found this early stage resectable colon cancer. So in other words, that IPMN and that MRI scan, because of the IPMN, likely saved this patient's life. So go figure. It's cases like this that I tell myself, maybe the IPMN truly is for a reason. Now, with that being said, I definitely wish I did not have the IPMN. I mean, let's not kid ourselves here. But, it's just one of those things that when I saw this, it made me smile. It kind of made my day in a way, because I said to myself, you never know what life has in store for you. And it's true. So for those of you out there, you never know what life has in store for you. So I really do hope this case brings you a smile the way that it brought me a smile, if you're one of us that suffers from an IPMN. So like, subscribe, leave a comment. I love reading comments that you guys leave me. All right. And I'll see you on the next encouraging case video.